The American Hospital Association says an older healthcare workforce, a surge in retirements, and pandemic burnout is driving a nationwide caregiver shortage.
When do we want it? Now!
They also say there just aren't enough students graduating to take their place.
There are staffing shortages in healthcare regardless of what COVID did to us, but COVID exacerbated it.
Doug Levine is UC San Diego Health's Director of Talent Acquisition. He says they currently have just over 200 open nursing positions. That's about a 7% vacancy rate. He says there's also a need for occupational therapists, surgical techs, and other support staff, including food service workers and custodians.
I can tell you that last year, in the calendar year 2022, we increased the size of our nurses and medical staff by 6%. That's huge. But my patient population grew by more.
When it comes to recruitment, Levine says there's options including sign-on bonuses and covering relocation costs. The San Diego market comes with its own challenges, though.
The fact that San Diego has some of the highest inflation rates in the country doesn't help the situation, as well as the housing market.
Dr. Nicholas Holmes is Rady Children's Hospital's chief operating officer. He says they also have a need for nurses and respiratory therapists and lab staff. Holmes says they use incentives like sign-on bonuses on a case-by-case basis.
There's only 7 children's hospitals in the state of California, so that same specialized nurse or technologist, and if they want to be in California, is looking at all of the children's hospitals. So we're competing at all levels in all regions.
Holmes also says physician specialists are in high demand.
It's not only just pediatrics. I think it's across the country in all areas, both adult and pediatrics, where we're going to see some significant changes related to physician shortages coming up.
The American Hospital Association is working with lawmakers to try and address the shortages. They say that workforce costs can make up more than half of a hospital's budget. Matt Hoffman, KPBS News.